At California Hair Surgeon, here are some of the devices that we can choose from to perform FUE. On my left here, this is called an Ertip device. It's made in Turkey. It is a sharp punch, which means it might have a slightly higher transection rate of the grafts. You need to have a lot of experience using an FUE device in order to use one of these. One of the nice things about this device is that you can change how fast it is moving, and it moves its punch in a complete circle, so it's rotational. The next device is also a sharp device, but the benefit of this one, and this one's made by Cole Instruments, it's called a Vortex. The benefit of this device is while you are doing the procedure, and I don't have the autoclavable tip on this right now, the sterile tip, because I'm going to be using it for a procedure. But the nice thing about this device is that you can adjust the depth that the punch goes into the skin at any time. Now this is important because different grafts are at different levels below the skin, and if you're using a sharp punch, as I mentioned before, you have the potential to cause more damage to the graft in the form of a transection. A transection just means cutting the graft. If you cut the graft, it doesn't grow as well. This is the S.A.F. Scribe. If you'll notice, I actually have two S.A.F. Scribes here. This was one of the original FUE devices. It used a blunt punch, which is to say, the little tiny tube that we center on a graft had a blunt tip. The reason that it actually was able to cut the skin, if you pushed on it like this, it wouldn't cut the skin, but the reason it was able to cut the skin was that you could change the speed, the rotational speed of that tip. When it was spinning very fast, it became a cutting tip. Once it got into the tissue, it was blunt. It did not cut the graft, which was a lot safer for the graft. This device is still very useful, and it can, if you don't have the right angle, it can end up burying some grafts, but you don't usually end up damaging the grafts by transecting them. Now this one is actually another version of that. It has a blunt tip, but it's in a hexagonal shape. They call it the hex. And the reason that this is useful is because it breaks the suction that a completely round tube would have. So if you imagine a completely round, like a completely round straw, and you inserted that into some Jello, when you tried to suck it out, it would have that suction on it. But if that straw had little angles all the way around, that would break the suction, and it would allow you to withdraw the punch, or in this instance, the straw, without pulling at that graft and hurting it. This device is called the WAW device. It's actually made in Belgium, and the reason that this is useful is because the individual rotational speed is adjusted using this foot pedal. So you can adjust the rotational speed, and the punch that it uses is novel. It uses what's called a trumpet punch. So it's both blunt and sharp. The opening has a small fluted edge, and that edge can also be serrated for the different types of applications that you would use this for, the different types of surgeries that you'd use it for. The outer edge is sharp, and that's how you cut through the skin, but the inner tube will collect the graft, the different hairs of the graft as you go down, and thus not damage them. I will be honest and say that it's my favorite because my transection rate went from between 1% and 8% down to 1% to 3% within the very first few surgeries that I did, and that's why it's one of my favorites. It's also just a dream to use. All of these different devices have their advantages and different disadvantages. An experienced FUE practitioner might switch in the middle of a surgery and choose anything that they need. If you're doing a body hair FUE, you might choose a different device. The important thing is to choose a surgeon who knows what these different devices can be used for and who has that selection at their disposal so that they can adjust for your particular case. If they just have one single device, it's the classic old adage, when you have a hammer, every problem looks like a nail. If all you have is a single device and you're trying to apply that device to every single case, you're not doing the best job you possibly can for your patient.